All right, well, hello there. I am Dr. Brent Whited here at the Steindler Clinic. I am a surgeon that specializes in hip and knee replacement surgery, and I've been part of the group now since 2010, so going back a few years. Yeah, so orthopedic surgery definitely was something that fairly early on in my medical training I knew appealed to me, and that was the type of thing I knew I kind of wanted to be a surgeon. And the orthopedic folks we trained with, I really identified with and saw myself doing what they did. I think the great thing about being a joint replacement specialist like I am is it really gives you a great ability to truly help people and get folks back into being active and doing a lot of things that they've been unable to do. So to me, it's been very satisfying and been a good fit for me. The majority of what I do, certainly surgically, is replace people's knees and hips, which is a very common thing, especially in our old aging population, for that to be an issue for. So this is really people that have had a history of their joints kind of going bad and becoming painful. A lot of times they get stiff and swollen. And so, I have the ability to help make those things better, and so that involves doing folks that have gotten their joints worn out. I also do revision surgery, and so that also is a big part of my practice, fairly unique amongst the group, which not a whole lot of the other guys will do. And so that helps for people that have previously had a hip or a knee replaced that maybe has worn out or has gotten an infection or has been having some problems. And so that involves kind of doing things over again. So that also, I think, is helpful because not everybody's able to do that. So that's the majority of my practice and what I do. To me, as someone that might be a new patient, I think it's always important that I connect with you as a person. And I always tell my patients I'm just a regular guy, and it's true. I think you want to get to know who's taking care of you, and I certainly want to know your background and where you're from and what life has been like for you. So to me, that's important to be able to connect with my patients just on a real individual level.